Many clinicians are trained but terrified to treat noses, and that's for good reason, the risk of blindness. In this episode, I'm going to cover an area of the nose I think you can inject pretty safely without having to worry about this side effect if you follow the right safety steps. The nose tip is a much lower risk area to inject compared with injecting the nasion. It's in the upper third of the nose where the dorsal nasal arteries and the supratrochlear artery may meet, allowing filler to make its way into the eye in extremely rare cases. There are many things you can do to avoid that, but even simpler is to inject lower down when you can. So the nose tip is less risky, but also has its own risks. And in this episode, I'll be covering some of my nose tip injection techniques that allow me to inject in a way that I feel is safe and so far has never caused a complication. This week's question came from Mary, who's one of my Pro Injector members. If you're interested in joining the membership, see the description down below. So when I'm injecting a nose tip, what am I thinking about? The first thing is you need to know whether or not the nose is actually going to bend to your will, because some noses, if you squeeze them, are quite well adhered. They don't naturally want to change position. The ideal nose is actually quite loose and flexible. That means there's a potential space in it where you can feel filler could go and then change the shape. So step one is always to feel the tip of the nose and sense whether there is room for filler so that you can change it in the way that you want to. The next thing is to think about safety with injection. Safety in the nose tip is much more about pressure than it is about vascular occlusion. Of course, you can cause vascular occlusions anywhere in the face, but the nose tip is different. It's covered in a very small superficial capillary network. And the reason it gets necrosed is usually due to pressure compressing those capillaries rather than injecting directly into the vessel, which can happen too, but it's just more common in my experience that the nose goes red. Now, the confusing thing about this type of necrosis is that often capillary refill seems to get less rather than more. It takes less time, so it's almost an instant. As you push on the nose, it's so red, it stays red, and it almost doesn't flash white at all. This is, I think, because the vessels are so dilated and so open that you can't squeeze the blood out of the skin as easily as you maybe once could. To avoid this, it's all about injecting the least amount of volume that you need in order to get the result, and checking as you go through, is this nose responding appropriately? Is it lifting according to the product I'm putting in? But also, is capillary refill normal? I think that when you first inject, capillary refill might be delayed, but as the vessels accommodate, you get this shortening of capillary refill when it's actually struggling for blood supply. The next thing that might help you when injecting the nose is, in terms of safety, it's easier and less painful to inject from the superior surface pointing downwards. So what I'll typically do is bend the tip of my needle like this and insert into the nose so that I'm parallel with the surface, able to inject from this sort of angle as I puff out the surface of the nose. So I'm injecting at this angle with the tip following the trajectory of the nose, injecting in such a way to project the nose out in the direction that I want. Now, of course, this angle of injecting only alters the surface of the nose, and sometimes in a more difficult situation, we want to actually lift the nose and open the nasolabial angle. Nasolabial angle, the angle between the nose and the lip, is opened up by injecting underneath. Now, there are multiple ways of lifting a tip, but it all depends on your appetite for risk. One of the more fun ways that you might see, which I have done once or twice, but I've decided to stop doing down to safety, is that you can put a long needle all the way down the columella, all the way down, and touch the maxilla, and then inject up almost in one injection all the way up and elevate the nose tip. Now, what I don't like about this is just the amount of volume going in, and you are parallel with the columellar artery. Now, the columellar artery sits in a plane, just like most arteries, in between the deep surface and the more superficial surfaces. So it's underneath the hypodermis, usually at the layer just between the hypodermis and the next layer, which in this case might be cartilage or a small amount of muscle. And then you have the cartilage itself. If you dissect on a cadaver course the columella, you usually see the artery at this level. It's not a very big artery, but it does make me worry when injecting parallel with it. So you can attempt to do that with a cannula. The downside with which one of my clinicians discovered is you get a higher incidence of not being able to reach all the way down to the maxilla when injecting. And so one of the side effects is getting filler in the top lip, and the patient will feel it on the posterior side because the filler is now on a more superficial level. than it should be, which means it doesn't stay stable on the bone, but instead, after a few weeks, will track into the lip envelope. So I don't like using a cannula in the nose for that reason. The way that I prefer doing it is to inject with a needle deeper. I'm following the same principle that I use in many other parts of the face, which is you tend to be safer where the vessel hasn't emerged into the face if you are on a deeper plane, which means an angling down to the periosteum onto the nasolabial angle with an injection like this, then coming out, changing angle again, and building up a column of filler within the columella so that you lift the tip gradually. This should create a supporting structure within the nose. You obviously do all your safety steps in between. I'm just showing you the technique that creates a little bit of a lift. Don't forget, also important to treat the nasolabial fold if you want to create lift to the nose tip. Those are my nip tips. Those are my nose tips, my tips on nose lifts, my nose tip lifts. Those are my nips tips lifts.